On this edition of Veterans Health Watch, we'll be celebrating the 100th episode of the cable show along with past co-hosts, and we'll be looking back at some of the show's most memorable moments.
We'll also discuss the impact of the show on veteran guests, viewers, and co-hosts.
Welcome to Veterans Health Watch, a program sponsored by the Veterans Affairs Maryland Healthcare System that provides the latest health and benefits information for veterans, their families, and the community. I'm not sure if many of you remember me, but I served as a former co-host for Veterans Health Watch. I am Monica Smith.
Hi, and I'm Dr. Robin Heinzman, another past co-host of Veterans Health Watch. In recognition of the filming of the 100th episode, we have asked our regular co-hosts, David Edwards and Kenya Griffin, to reverse their roles and serve as our guests today. Welcome, David and Kenya.
Thanks for having us.
Yes, thank you. Thanks for joining us.
David and Kenya, it's so great to be here. And David, I want to start my first question with you. What actually started the whole implementation and development of Veterans Health Watch?
Well, Veterans Health Watch grew out of an initiative to try to reach out to the community about 12 years ago, find another way of sharing information about VA healthcare benefits, information about VA eligibility, access, volunteer opportunities. So it was a new form and medium for us to get out into the community to reach our veteran patients, but also to reach the greater community as well.
Good. And we all know that there is always a need for more information and communication with our veterans. So I commend you for starting the show.
Wonderful. In Kenya, although the Maryland Veterans Health Watch continues to be a focus for veterans, we know that the show has really undergone a few makeovers, including studio locations, show openings, and a variety of co-hosts. Can you describe some of the makeovers?
Well, as David mentioned, we started about 12 years ago, and we filmed this show originally in the Mayor's Office of Cable and Communication in downtown Baltimore in the studio. But however, there was a flood a few years later, so we had to move around a little bit. We went to the Baltimore VA Medical Center and filmed in the auditorium. We filmed at the Perry Point Medical Center in the theater, actually in the studio there. And now we're back filming in the Mayor's Office of Cable and Communication. So that's just one of the changes, our locations. Another change has been the intro for the show. We've been around for 12 years, so a couple of years ago we decided to spice it up a little bit. We've created a more up-tempo intro for the show, including new photos of veteran patients and employees. So those are just a couple of the changes we've implemented over the years, including using several co-hosts, as you and Monica.
Great.
And Kenya, I'm going to go back in my archives and remember, I think it was about 2005 that you all started remote interviews. What has that been like, and have you continued to do that as well?
Yeah, the purpose of the remote interviews was to show the vast amount of programs and locations we have within the VA Maryland healthcare system. We have 8 locations throughout the state, and each of them are unique. So we use the remote segments. Actually, that was my first time serving as a co-host, was as a remote reporter. But we use those segments to show the different programs, such as driver rehabilitation for those veterans who've endured an injury, but they still want the independence of driving. So we have a driver rehabilitation program. We also featured our stroke rehabilitation study for those veterans who have recovering from stroke even 20 years out. These research studies help them to regain independence, learn how to use their limbs again, learn how to walk again. And then we've also visited veterans in their homes with our home telehealth program. Our first veteran participant in that program, we also interviewed him in his home to show how he can work with his nurse without leaving his house.
Wow.
I really love the idea of remote interviews. It just brings the message home a little bit more clearer for persons who maybe never have come to a VA before, either a veteran themselves or a family member. So good job. I'm glad you guys started that.
Thank you.
Wow. In addition to that, David, over the years, you've covered VA Maryland healthcare system's tributes to veterans, including the Welcome Home celebration for our newest generation of veterans who've returned home from Iraq and Afghanistan. What has been the impact of these events?
We've been sponsoring Welcome Home celebrations for our returning veterans and the local community for the past couple years, and it's really been a wonderful way to welcome these returning veterans home into our community. We know in past wars and conflicts, veterans didn't always have a great reception coming home, and so we wanted to really step outside the box and provide a unique experience for them coming home to make them feel welcome, to help them transition into VA healthcare, and to bring in their family as well, because it's more than just the veteran that's having to deal with coming home and dealing with the trials and tribulations that are involved with that in the whole transition process. It's also the family. So we started sponsoring Welcome Home celebrations. The last 3 years we've been holding concerts called Valentine's for Veterans concerts at the Meyerhoff Symphony Hall, and we featured acts like Martha Reeves and the Vandellas, the Temptations, the Drifters, and it becomes a celebration. We get an opportunity to recognize them during the concerts. We also get an opportunity to provide them information about VA healthcare, their benefits, and the services available to treat them. It also becomes a unique opportunity to encourage the local community to volunteer at their local VA medical center or outpatient clinic and to learn about VA healthcare. A lot of our community members aren't always familiar with the full aspects of VA healthcare. Today's VA is a lot different than it was years ago, and I think that's one of the important messages for the community and the returning veterans is this isn't your father or your grandfather's VA. It's a new VA, and we want you to come out and learn about what we have to offer, but we also want to take this opportunity to welcome you home and to thank you for your service.
And David, I want to tag on to that. It's a new VA. It's not your old VA, because I know this show has covered a lot of the new programs and services that you offer for veterans. So tell us a little bit about some of the topics you've covered.
There's been some exciting new technology and program introductions in the past couple years in the VA. I think one of the most exciting programs that we featured on Veterans Health Watch is the new My Healthy Vet program, which is an online service for veterans to access their own personal health information, to order prescriptions, to look at lab results, to now actually connect with their providers via secure messaging. So this is a unique program that is allowing veterans to, from the comfort of their own home, access important health information. The other new initiative that's really been a unique new feature in VA, and it's a national program, is telehealth. We all know that it's very challenging when you have individuals in remote locations, not just in Maryland, but throughout the country. So it's a wonderful new resource that we were able to feature that is really bringing expert healthcare and state-of-the-art healthcare into the veterans community.
Good.
In Kenya, what sources do you use to gather ideas for show topics, and how do you determine the guest?
Well, we have a great producer, Margaret Hornberger, who has her finger on the pulse of what veterans' needs are. She works closely with them to determine what they want to hear in the show. She actually hosts focus groups to hear directly from the veterans. We also work with our subject matter experts who are VA employees. Sometimes they're clinical directors or they're program managers, and they talk to us about new initiatives that they need our help to advance and get out there to veterans. So we work with them to get topics for the show. And that's pretty much how we develop the topics for Veterans Health Watch.
Well, Kenya, it sounds like you've covered a broad spectrum of topics. And one of the things that I like is that you don't just cover healthcare, you cover VA benefits and VA cemetery as well. So great job on all your topics.
Thank you, Monica.
And we're going to go to a break. And when we come back, Robin, we'll get a chance to go down memory lane.
Yes.
And think about some of the fun times we've had here on Veterans Health Watch. Come back and join us.
The VA Maryland healthcare system is a great system.
It's not your grandfather's VA.
We are a progressive and dynamic healthcare system.
And it's our mission to provide the highest quality healthcare to our veteran heroes.
Great programs, great technology, great staff.
And it's just touching to see how everybody just come together as one.
We do what we can to see that they get the best service.
It's a family. Nobody takes better care of you than family.
Welcome back to the 100th episode of Veterans Health Watch. Joining us again are Robin Heinzman and Monica Smith, two former co-hosts from Veterans Health Watch. Robin, Monica, thank you both for joining us today.
Sure.
Monica, you were instrumental in getting Veterans Health Watch started, first as a producer and then as a co-host. Can you tell us about that experience and what it meant for you?
It was one of the greatest experiences I've had working as a VA employee. A lot of research went into it. We found a lot of partners to help us with this initiative, a lot of creative work, looking at storyboards, pictures, music. So it was very fun to start this, and I was very excited to have the opportunity to lead that project, and got an opportunity to bring back the skills I learned at Towson State University and the communications program. So a lot of work, a lot of research to make this happen.
Well, you should be proud of where it is today with 100 episodes later.
Monica, how would you say your involvement in the show has impacted your career or even your daily interactions?
Oh gosh, this show meant so much to my career. It not only did it give me an opportunity I never had, but it gives you the opportunity to feel like the role you're playing as a VA employee really is special, really has meant a lot. Just being out and talking to fellow employees or family members or my own family members who learned some things about VA that they never ever knew. And I think for me that was the most significant portion of my role in this. It's just knowing that I made a difference in helping people learn better about the VA, to learn that we have phenomenal programs, that we provide phenomenal care to our veterans. So I think for me that's the proudest moment I had working with the show.
Well, you talked about your proudest moments of the show, but what are some of your most memorable moments from filming Veterans Health Watch?
The camaraderie. There is so much love in the VA family amongst employees, and I really love you guys. It was just so fun being here, and I think the funniest moments I had were just the giggles and the goofs that we had here taping the show. Although it was serious topics that we were covering, we made an opportunity to enjoy each other's company. So I think those are my favorite moments, and feeling like a little bit of a celebrity when I went out and people saying, I know you from somewhere, and I would just look at them and say, yep, you probably do. So those were great moments.
Monica, you mentioned you conducted a lot of research for this program and you were really prepared, but what are some of the challenges you faced developing Veterans Health Watch?
Well, I remember one particular challenge, Kenya, and that was initially we were only able to air in Baltimore City. And back when I was co-host of the show, we had an estimated 500,000 veterans in our service area, and I really knew that we weren't getting to all of our veterans and all of the communities that we serve. So I had to do some further digging and was able to outreach to Baltimore County, Anne Arundel County, Howard County, and some of the other counties that we serve throughout Maryland. So that challenge was overcome, and I'm very glad that we overcame that challenge because it gave us an opportunity to further reach into the communities and be able to provide more information to the veterans and their families.
Robin, your background is in clinical psychology. So how did you become involved with Veterans Health Watch?
You know, David, that's an interesting question, and I think that the connection is that this show has been a great platform for health care. And I, being a clinical provider, have found that one of the best things we can do is to advocate for our veterans to have great health care, to know how to access health care, and to be, really proactive in getting involved in their healthcare system. And so I felt that there was a true connection between what I do as a clinician and what we did here on this show.
So Robin, how would you say you've grown from your experience as a co-host for Veterans Health Watch?
Well, you know, it's interesting. I think that in my professional career, I do a lot of speaking and previously had, but it certainly helps to make has helped to make me more comfortable speaking. It diversified my understanding of all aspects of healthcare. As David said earlier, I'm a clinical psychologist, but the topics that we cover here and have covered on this show have been broad. So I became certainly much more aware of the full scope of healthcare issues that are important to veterans and to the community. And that, I think, made me a stronger clinician and now a healthcare administrator.
Robin, we're going to be going to a break soon, but I'm sure you have a few stories about some of your most memorable and funny experiences filming Veterans Health Watch.
Well, some of them I actually can't share because they were behind-the-scene jokes. And just as Monica said, just great camaraderie with this group. A lot of laughs. Some of my funniest moments, I think they say laughter is great therapy, certainly happened on this show. But many of them also happened outside of here. You know, in my church each Sunday, many of the congregation would come up to me and talk to me about episodes of our show. When I'm in the grocery store doing my shopping, folks would come up and ask me about the show and what some future topics might be, and so that they would know to stay tuned. So it really helped me to understand how important this show is in our community and how valuable this kind of information is, and how even when we thought that maybe only our veterans would watch, clearly many people are watching and they rely on it for good information. And so that helped me certainly to realize that we had something really special here.
Monica, Robin, thank you so much for coming back to join us for our 100th taping of Veterans Health Watch. It really means a lot to all of us here.
Well, thanks for having us.
This has been a lot of fun and an honor.
We're going to take a short break, but when we come back, we're going to be joined by some of our previous veterans who appeared on Veterans Health Watch, so stay tuned.
A lot of women veterans don't realize that the VA is here to take care of them. They served and they deserve the best health care that there is. The Women Veterans Program has been redesigned to meet the needs of the women veterans.
Female veterans receive just as good a care as men because they're focused more on us now.
We want them to come here, we want them to feel welcomed, and we want them to know that we are capable and willing to take care of them.
Welcome back to Veterans Health Watch and our continuing celebration of the 100th taping of the cable show. We're now going to go to Andrea McCoy at the Baltimore VA Medical Center to hear from some of the guests and veterans who were on previous episodes of the cable show.
We are here at the Baltimore VA Medical Center reminiscing from guests from past Veterans Health Watch cable shows and public service announcements for the VA Maryland healthcare system. Welcome, everyone. Dr. Jacoby, you appeared on a past show concerning post-traumatic stress disorder and how it affected our veterans with PTSD. Can you share with us how this impacted your veterans with whom you come in contact?
Definitely. About 3 weeks after the show aired, I actually had a bunch of calls from veterans who were interested in coming into treatment. And when they came into treatment, they would comment about the show, and they would comment about all the different things that Rick had shared during the show.
And Mr. Day, you joined Dr. Jacoby on that cable show. Can you share with us how this impacted the veterans with whom you come in contact, as well as your family and friends?
My driving force was to help other veterans, because I didn't know I had it. And once I found out I had it and things I'd been through, I had a reason to me why I was doing the things I was doing. And my family, they didn't have a clue. But now it's kind of like, instead of being the enforcer, I'm the peacemaker, because I'm not as angry anymore.
Oh, that's wonderful. We also have joining us Dr. Patricia Ryan, who works with our veterans who have experienced traumatic brain injuries. Dr. Ryan, can you share with us how this has impacted the veterans you come in contact with?
Well, the biggest reaction that I got was, oh, now I know what it is that you do, because nobody seemed to understand exactly what it is that we offer people in polytrauma and in neuropsychology. So we're very grateful to Veterans Health Watch for helping us get the word out about all the resources that are available to help veterans.
Thank you. And Mr. Lake, you joined us on that cable show. Can you share with us what was the driving force that compelled you to tell your personal story?
Well, for me, trying to share that story is to throw a fish line out to draw them in, because I had the opportunity and the ability to get the right treatment, be on the right track. It was humbling because, you know, I'm a pretty proud kind of guy, and I have a lot of things to deal with. But I had an ear, and I had a hand, I had a leg, I had a foot, and they were able to get me on the right track, help my family get organized, because that was pretty tough. And also, they had an avenue for my children, and they got a lot of good treatment. And you come to find out that gray area about the psychological issues are not so bad, and you're not your ailment. You can be your ailment if you want to be your ailment, but if you want to challenge your ailment, you can.
Thank you. We have with us Ms. Erica Gillespie, who appeared on a public service announcement regarding women's health. How has this experience affected you?
Well, this experience has allowed me to be able to share my story, first of all, and to use my experiences that I've had within the military and transitioning over to the VA healthcare system. It allowed me to let people know that you don't have to let your past or your diagnosis or anything you've experienced dictate your future.
Thank you. And we have our Women's Health Program Manager, Ms. Zelda McCormick, has been on both a cable show and our public service announcement regarding women's health. How has this experience affected you?
Well, I received an overwhelming response from veterans, both men and women, after having done the public service announcement. So much so that I got some enrollment packets to keep in my car. Because when people come up to me, they're like, I didn't know you worked for the VA. And I'll ask, are you a veteran? Well, no, but my sister is, or no, but my cousin is. And I'll give them the enrollment packet to tell them, enroll. If you have any questions, here's my card. I can help to navigate them, through the system to make sure that they are enrolled and can get the services that they are entitled to and deserve.
Awesome, thank you. And last but not least, we have with us Mr. Kevin Grodnitsky, who has appeared on several of our cable shows to promote the VA Maryland Healthcare System's MOVE program, as well as healthy eating. Kevin, how has this experience affected you?
Thanks, Andrea. At first we found that we definitely got more calls after the shows. I was on 2 shows. Secondly, some veterans responded that it was inspiring to see the success stories. We had 2 veterans who experienced improved weight loss outcomes, and I think veterans, if they can see other veterans succeeding, losing weight, keeping it off is challenging, but if they can see other veterans doing it, it's inspiring, and I think that was the greatest impact of having them on and participating in the show.
Thank you.
You're welcome.
Thanks to each of you for joining me today to help celebrate the 100th episode of the Veterans Health Watch Cable Show. Happy 100th episode! Now let's return to the studio for more celebrating.
Thanks, Andrea. And Kenya, I have been watching you all over the years, and there's a very interesting program that you all developed. It's called Televet. And I was very excited to see that. Tell us a little bit about that program. I know it's more of veterans interacting with their fellow veterans, telling them about your services. Tell us about that and how'd you implement that service and what it means.
Televet is based on word of mouth. Word of mouth is one of the strongest ways to communicate any program, any initiative, any idea, because you're hearing from someone you trust. So we wanted to encourage veterans who were already enrolled in the healthcare system to share that information with their fellow veterans. And we also wanted to encourage employees, family members, anyone who knows a veteran to tell a vet about the VA Maryland healthcare system. So we have a video to give you a little more information about the program.
Okay, well, let's go to the video.
As a nurse, it's very important for me to see a friendly face when I come into the hospital.
On my last tour, I was a drill sergeant, trained some soldiers, and had an unfortunate accident.
I really didn't think I was qualified because I didn't have a service-connected disability.
I researched because there had to be some answer somewhere. There had to be some place for combat veterans to go.
Did you know that the Department of Veterans Affairs has been recognized for offering the best medical care in the U.S.? Locally, the VA Maryland healthcare system provides a full continuum of quality care to our nation's veterans, including medical, surgical, rehabilitative, neurological, primary, mental health, and long-term care. With a dedicated, highly trained staff, the VA Maryland healthcare system is committed to serving the needs of our nation's veterans at 8 locations throughout the state. The VA Maryland healthcare system is always there to serve and honor America's veterans.
At the VA Maryland healthcare system, we're proud of our investment in technology because it's an investment in our veterans.
I was really surprised. It's a modern clinic with doctors for excellent care.
You know, there's a sense of just that camaraderie. You feel really comfortable, and it has been helpful for me.
The categories of care have been opened up so that more veterans can qualify.
I would highly recommend all veterans to at least come down here and talk with the patient representatives and see what they are entitled to.
If you or someone you know served in the armed forces, tell a vet to call 1-800-463-6295, extension 7324, to inquire about enrolling in the VA Maryland healthcare system. It's free to inquire and easy to enroll, so call now.
When I came home from my military service, I knew that I needed help, and I went to the VA and they were there for me.
That was a great, very interesting video. Now, David, we've been spending a lot of time reminiscing about the past, so let's take a moment to look forward to the future of Veterans Health Watch. What do you envision for future episodes?
Robin, we're going to continue to introduce new and exciting programs for veterans on the cable show. We're also going to bring in more veterans to hear their real-life stories about how VA healthcare has helped with their lives. We also help to reach out into the community more and make more veterans aware of the services that are available to them. And one of our big missions with Veterans Health Watch is to reach out to the community to help educate those veterans that don't even realize or are aware that they're eligible for VA healthcare. So we're really hoping to maximize that in the future.
David, it definitely sounds like Veterans Health Watch has a bright future, and I'm excited about the episodes yet to come.
Robin, Monica, thank you so much for being here today. You really helped to make the 100th episode or the taping of the cable show, so thank you very much.
And I just want to say bravo to you all and to everyone who has a part in this show. Great job. Keep doing the wonderful things that you're doing to share the great news about the VA.
Well, Monica and Robin, thank you for getting us started. We wouldn't be here at the 100th episode without you.
Thank you.
Sure.
This concludes our 100th episode of Veterans Health Watch. I'd like to again thank Monica and Robin for joining us, but I'd also like to recognize my co-host Kenya Griffin, who has done an outstanding job over the years. And I'd also like to recognize our producer Margaret Hornberger, who does such an outstanding job putting the show together every month and finding those good stories.
Thank you, David. I look forward to more episodes of Veterans Health Watch. And remember, if you are a veteran or you know a veteran who is not enrolled for VA healthcare, please give us a call at 1-800-463-6295, extension 7324. We look forward to serving you.
Since its inception nearly 12 years ago, the Veterans Health Watch cable show continues to serve as a vehicle to provide veterans, their family members, and the community with information about programs and services provided by the VA Maryland healthcare system. On the occasion of this 100th episode, I wish our staff continued success with this very valuable and informative show designed to meet the unique needs of the veterans we serve.